Hi, my name is Ariel, and this video will be an update to my injury video. This is roughly 5 years ago now that I fell 5 stories. I shattered my tailbone, I fractured my hip, my lumbar, knee, both feet, and yeah, it was a horrible experience. Getting off of that Foley catheter, transitioning to a different type of catheter, because even without I think I thought after I removed that Foley catheter, we're keeping it on because I couldn't walk for that period of time for about 7 months. So we kept it in. And I thought, when I'm ready to walk, I could just remove it and everything would be fine. But it just wasn't like that. And being on the catheters like that for about 15 months, it's like your body gets used to it. And even the process now, what it has become, there are no devices, but I need an alarm clock to tell me when to go. A really loud one. There's actually a very good one. It's called the Sonic Boom, and it has a little vibration pad that also attached to it that you can put underneath your pillow. And the sound is so loud. I love it. And it's really saved me. I was always so scared if I get too exhausted, I won't wake up in time to use the restroom. My bladder will fill and expand and burst, or it can go back up into the kidneys, and that's also horrifying. It's a daily struggle to make sure that I'm following the rules that are necessary to stay alive. There's also an inner knowing that as I get older, it will be more difficult for me to use the restroom the way that I am. I'm generating all the force. The bladder is not really helping me with that. And to do that, I create a lot of pain. It feels like I'm kind of pushing the tailbone through through the skin. It's very painful. And, doing that 7 to 8 times a day, it takes a little while to even recover from that. And sometimes, I'm good at putting on a happy face and pretending that everything's okay. I think that's just the kind thing to do. This is going to be happening consistently on a daily basis, so I have to find a way to work with it. What helps is really thinking about those days when I had that Foley catheter and I had to travel with it, and how difficult it was to move after surgeries. The uncomfortable parts where you're coming home with the drain, and you're draining out the fluids after your surgery, and mine were on the back, so it's like I would get them stuck underneath my arms, as I'm moving around. It brings up this issue that I'm currently dealing with touch. I think spending all that time in the hospital, you lose the autonomy over your body. Every time they enter the room, you have to show yourself, whatever they're looking for, whatever they want. Give me some blood, you have to do it. So it's like you're giving up agency over your body. And with the different sensations that you're feeling, it doesn't feel normal. It feels like you don't even have control over your own body. And it reminds me too, when I stopped taking the pain medication, I really didn't think that would ever happen. I thought, well, this is a really severe injury. It's okay if that's, you're on pain medication the rest of your life. It's fine. But there was a moment where I felt like, I can do it without the meds, and slowly just like reduce them. The sensations just return. The sensations that are numbed from the medication, it just returns and you feel it strongly. And it's interesting because I think people who do go through drug withdrawal would understand what it is that I feel on a daily basis, that uncomfortable in your body. It's your body's buzzing around, like there are movements just underneath the skin that you feel like just jumping out of your body. You don't belong to your body anymore. And this was something I just had to learn how to master and to deal with, actually using those sensations to connect to something greater, using that body connection, and being forced actually to listen to the body, finding other ways to sense these things using other parts of your body. Like my stomach, for example, can tell me when I need to have a bowel movement. It may not give me a lot of time, a lot of warning, but at least it's something. And the bladder also as well, I'm starting to feel different sensations. The sensations are returning, but it's not the same. You have to kind of get to know your body again. And what has really helped me there, even is connecting with animal energy. And it's so interesting because I've been working on trying to balance that masculine and feminine, because we need both of them to heal. We need that kind of fighter spirit in order to fight the pain with optimism. And that feminine side of self-care and healing, loving self. Both of them were needed, and I felt I had difficulty with both. And to work with them through animal energy, through wolves and through cats, even felines, pumas, I thought. Even one way I connected with my body, it's also even a wound of not belonging to the land. For some reason, there's just not belonging to the land. And what has helped me there, even with the way that I walk and my posture, is thinking of that animal energy. As I was walking actually a few months ago, I was feeling my tailbone kind of move, and it was the first time my tailbone moved, in years. So I felt like some sensations normal for a second. It felt normal. And I connect to this animal energy through a puma. There is actually a couple that owns a pet puma, and I've just been watching them for probably close to a decade. So I feel, I can really visualize this animal because I'm used to seeing it. And visualization really helps. And using the sensations that are uncomfortable within the body to connect to that animal energy. It may not feel like your body, but it feels primal. It feels instinctual. And in this way, you can connect to the animal. And I would even see myself as I'm walking, I would have to walk heel to toe to practice my posture while walking. I would just see myself as a puma. My feet would turn into the paws, and my hips. There's a way that the puma, as it walks, it's like very sly, like the hips, they dip, and it's sexy kind of, and just tuning into that and walking and feeling that energy. Animals never question their belonging to the land. They just are. They just exist, and they take up space. And so tuning into that energy just makes me feel like, okay, yes, I do belong. I belong here on this land. I belong in my body as well. This is mine. This is natural. This is my new natural. Even watching the older videos, I notice, because those videos were made as I was just going through the drug withdrawal, stopping buprenorphine, lowering gabapentin. At one point, gabapentin was 3,200 milligrams, which is wild. I mean, I've heard years ago that the limit was 1,600 milligrams. So, I mean, what are you doing, guys? I even went to the doctor and said, that this affects memory and the mind. Oh, yeah. But I understand too, it's like, would you rather be in a lot of pain, or would you rather lose your memory? Like these are the options. And so part of me just saw that and just wanted to check out of forget this medication. I can do it I'll handle the pain then. And lowering that, I'm still on that medication. It's like 300 milligrams now, which is fantastic. But I have noticed long-term damage. There were certain medications even that I would take, and I would go outside and I would forget why I even left my home, where I was going, where am I, how do I get back home? And that fear that comes up, it's like I understand now how devastating losing agency over the mind now is just terrifying. And so I'd rather just deal with the pain. But the gabapentin, it makes you, it's hard to search for words, that filter in your mind, it will give me a few options and like, okay, this one looks right, send it on through. Turns out maybe that's not the right word. Oops. It's tricky, it's difficult, and you have to be patient with yourself. And I've seen it improve, but of course, there's just definitely long-term issues. And I just give myself time, and that's what we need to heal. Time. I don't think we can even get around that. We need the time. So the main goal is to just survive so that we can have that time to heal. But even in those early videos, I can see the discomfort even in my movements. And, I've learned what kind of triggers that nerve pain, cold, any type of cold air. It feels much colder to someone with nerve damage. It starts from the feet, and it's like a big chill, and it goes right up your calves. But then there's a burning in the hamstrings and the private areas, a ton of different sensations that are so weird. So it's just uncomfortable to sit. My lower back pretty much numb, so we're good. I don't really feel a lot of pain there. I just feel the metal, like a wall, a resistance when I move. A pain in the upper back, sometimes it's rounded. I even notice my posture in those videos, and it's helpful actually to see it so I know what to work on. And the neck, always cracking the neck, and even sleeping with the neck pillow. That's what I've been doing. For a while I slept with no pillow just to avoid that incredibly tight neck in the morning. Tightness is where most of that pain comes from. So the movement is very important. Sometimes I'll shift around and move around. This is to prevent any sort of tightness, because as soon as it comes on, that pain is so strong. That's where most of that pain I notice comes from. So moving around, and sometimes it's very hard because you feel tightness with every tiny movement. It's like, how do I move? And in these moments, I just take advantage of my mind. I put on a song that really moves me. It really has to be a powerful one that convinces me that I should move around. You have to get yourself into those movements so you can lessen that tightness. Even knots in my back, I've had to massage them out myself. I've learned, it's the circular motion, but it's not frequency, it's quality. Making sure you really put down the pressure. And sometimes I visualize also. I think it's like a little tool to help. I visualize like smoothing sand, so smoothing over those knots. And it does help. It's going to be painful, and maybe it will last forever. But we have these moments where we can escape from that room, even if it's just for a few minutes, to escape and then return back with a renewed perspective or the memory of the joy that you had. Just allow yourself to be whisked away by whatever that distraction is. Maybe that distraction is even your passion. Try to extend those moments. I try to make them happen more often, to create joy, to create beauty out of life, to make the most of the time that we have. even just surviving on a daily basis and thinking of that as a victory. I just hope to help those people that are struggling. It's like sometimes in those moments I felt like I was looking and searching for a guide or someone to tell me, well, I've dealt with this and this is how you do it. And sometimes there is no map and you have to create it yourself. Thank you for joining me for this video. And yeah, I hope it helps someone. I really do. I hope that it can maybe allow you to think differently, perhaps, you know, or create an opening for more moments of joy within the pain, within the chaos. Thank you. Bye.